Morning, Al. How you doing? Wondering if this font size is good for you.
Yeah, I have my glasses today, so...
Asking you to put your mic on, thank you.
Yes, it's... Oh, wow. It could go smaller.
Slim thick, not... Okay.
Nice. All right. Perfect.
All right, great. Thanks much.
All right.
Yeah, man. This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to Al Alexander, Senior Corporate Communications Officer at the Ministry of Health.
Good morning, viewers. Good morning, viewers. We are pleased to have you back with us for today's virtual media conference by the Ministry of Health as we update you on the national COVID-19 response. Here to discuss the latest COVID-19 updates with us are Dr. Miriam Richards, Principal Medical Officer Institutions, Dr. Hazel Othello, Director, Mental Health at the Ministry of Health, and Ms. Salisha Baksh, Acting Chief Executive Officer of the Northwest Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be your moderator this morning. We now go to Dr. Richards, who will present today's clinical update and an update on the repatriation exercise. Dr. Richards.
Thank you very much, Al. Good morning, Dr. Othello, and good morning to CEO Bash. Good morning to members of the media. Thank you so much for your continued attendance and participation at these media conferences as the Ministry of Health continues to provide up-to-date and transparent information to the public. Good morning, Trinidad and Tobago. This morning, as Al outlined, I will be presenting a status update with respect to the clinical statistics in the parallel healthcare system, as well as the ongoing repatriation exercises for returning nationals. As of 4 p.m. on Sunday, 18th of April 2021, there were 134 confirmed cases of COVID-19. This number represents samples taken between the 15th and 17th of April 2021. The increase in the number of positive COVID cases resulted in the number of total active cases of COVID-19 bringing a number up to 847. Of these, 85 patients are at 3 of the hospitals in the parallel healthcare system. At the Quora Hospital, there are 14 ward-level patients. At the Cuba Hospital and multi-training facility, there are 52 patients, of which 6 are ICU level and 4 are HDU level. And at the Scarborough Regional Hospital, there are 19 patients, all of whom are at ward level. Currently, we are at week 15 when we look at epidemiological weeks for the year, which is how in medicine and at the Ministry of Health, we look at the trends for COVID-19. And we have noted a significant increase in hospital occupancy levels. So, for example, at week 11, we had an overall hospital occupancy of 2%. At the end of week 15, we have seen a significant increase in hospital occupancy levels up to 24%. As far as ICU and HDU levels are concerned, ICU levels have increased from approximately 2 to 5% to 25% over a 3-week period. HDU levels have also increased up to 10%, where we were previously somewhere between 0 and 4% between weeks 1 and 11. Additionally, and even more worrying, is the trend in terms of the rolling occupancy of the average number of COVID cases per day over a 7-week period. This trend resulted in cases at approximately 3 for weeks 1 to 11. Then at the end of week 14, we saw an increase from 3 to 32. And as of today, at the end of week 15, we've seen that number basically double to 77 cases per day over the last week. With respect to repatriated nationals and the state and state supervised facilities, there are 288 patients in state and state supervised facilities. And I'll go subsequent to this into a breakdown of the previous repatriation exercise for returning nationals from St Vincent and the Grenadines and an upcoming exercise on the 21st of April. Thus far, we have had 153 deaths. We had 2 deaths within the last 48 hours. And we would like to, of course, extend our condolences to the family members of the deceased. I'm now going to speak a bit about the repatriation exercises. And last Wednesday into Thursday, the Ministry of National Security and the Ministry of Health collaborated in an exercise to repatriate 76 nationals from St Vincent and the Grenadines. The exercise itself was carried out using the Galleon's Passage, of course due to volcanic ash in the airspace around St Vincent and the Grenadines, and members of the Trinidad and Tobago Defense Force, the Immigration Authority, and of course members of the media were part of that exercise. The returning nationals were housed in state quarantine facilities, and I would like to commend and to recognize the efforts of the Ministry of National Security and the Trinidad and Tobago Defense Force, the Immigration Department, the members of the media who actually went on site to St Vincent and the Grenadines, as well as the persons who were on the ground at the port in Trinidad and Tobago. That is the Port Authority of Trinidad and Tobago, NIDCO, the Port Health and Ministry of Health employees, and of course the TTDF. They were actually responsible for quite a successful exercise that was carried out over a short time frame to bring our nationals home safely. We have another upcoming repatriation exercise on April 21st, 2021. That involves returning nationals from Miami, and as of this morning, I have been informed that CAL has bookings for 128 adults and 3 infants. So that's 131 returning nationals. Of course, the aim of these repatriation exercises would be to ensure the safe return of our nationals who are in the USA, Canada, Barbados, the United Kingdom, and other countries, and to also keep members of their family and the population safe. We would really like to thank members of the population and nationals abroad for their patience and collaboration in this exercise that keeps our country safe from COVID-19. We also have to recognize the efforts of the exemption team at the Ministry of National Security, the Ministry of Health, all persons who work at the Airports Authority and are engaged in the logistics exercise once persons arrive in Trinidad and Tobago. This exercise itself requires a multidisciplinary team, and we have been quite successful in bringing our nationals home safely. The total number of persons vaccinated as at 4 p.m. yesterday is 16,462 persons, and we would like to thank members of the population for your continued interest in the COVID-19 vaccine. We would also like to recognize all the staff that are involved, especially those that work on weekends and on evenings. As I close, I would like to remind members of the population about their personal responsibility. We do have the vaccine available now for persons who are considered high exposure and high risk. That is healthcare workers and the elderly, persons that are above 60 years of age. However, Vaccines are just an additional layer of protection in the fight against COVID-19. I would like to implore on behalf of the Ministry of Health to all members of the population, please exercise our COVID-19 measures to reduce the risk of having COVID-19. That is, wear your mask properly, wash your hands and sanitize those items near to you, and watch your distance. Additionally, given the increased number of confirmed COVID-19 cases, let's avoid congregation wherever necessary, and let's also stay at home and contact the Ministry of Health on 800-WELL or 877-WELL if we have any symptoms that may indicate COVID-19. Let's keep ourselves, our families, our co-workers, and our country safe. Thank you very much.
And thank you, Dr. Richards, for this morning's clinical and repatriation update. We now welcome back Dr. Hazel Othello, Director of Mental Health, Ministry of Health, who will provide us with some practical coping tips to deal with the pandemic fatigue. Dr. Othello.
Good morning, Dr. Richards. Good morning, Mr. Alexander. Good morning, Ms. Bash. Good morning, members of the listening and viewing public, as well as media practitioners. Thank you for providing me the opportunity to do this again, Mr. Alexander. Trinidad and Tobago, we have been through more than a year of the COVID-19 pandemic, and we all know that it's brought changes to our lives that we did not anticipate and that we certainly did not plan for or prepare in any way for. And many persons have been affected by it in a variety of ways, and I don't have to list all those ways because we've spoken about them so many times. It's also been about 6 months since we've been talking about the phenomena called pandemic fatigue. And I have to once again say it's very real. It's not a made-up thing. It's not just buzzwords that we're throwing out there. It is real. People are fed up. People are tired. People are frustrated. You've had to have your whole life, disrupted. The things you would normally enjoy doing aren't happening. You may have had loved ones develop the illness. Things like that are stressful and difficult, and it's hard. And we understand that people are going through some very, very difficult times. As a result of that, we understand that there are persons who are just not very happy about what's happening. You may be feeling frustrated, you may be feeling depressed, you may be feeling anxious, or you may just be feeling overwhelmed. This is normal, it is to be expected, and what matters is not the fact that you experience this. What matters is how you treat with it, because most of us have experienced it to some extent at some point during this experience. So what really is important is how we treat with it. It's also important to note that this is not just a Trinidad thing. This is a global phenomena. People in every single country on the face of the earth are experiencing this. So let's get real about that and understand that we're not alone in this fight, and we just have to have a plan. So with regard to how we're going to get through this. I like to say that life has to go on. We have to live our lives. We have to do the things that need to get done. And we want to do those things in a way that is enjoyable and peaceful. But we also want to do them safely. So there may be things you're not able to do right now because it's just not practical or it's just not safe to do it. It may be disallowed as a result of a regulation, or it may be simple common sense. Not everything needs a regulation. But if it's going to keep you safe, then please keep doing it. I also like to advise people to be creative in finding ways to still enjoy life, even in a pandemic. And the technology that's available to us these days has been very, very helpful in that regard. It's helped us to be able to stay connected with loved ones. Helps us to be able to stay connected with loved ones even when we can't physically visit them. As a result of that, just yesterday I participated in a virtual birthday celebration. It was different. I'd never done one of those before, but it was a delightful experience because my family was able to connect with relatives that we haven't seen for years because, they have not been able to come home to Trinidad for various reasons. So it allows us to connect sometimes in even better ways than we're normally able to do. Talk about your feelings if you're having difficulty. Talk to somebody who's a trusted, listening, part of your life, somebody who's there for you. And if there's somebody in your environment who is having difficulty, try to listen, try to be supportive, and try to help them to get help if simply listening and talking about it isn't enough. Guide them towards the Ministry of Health's site, findcareTT.com, which provides a number of resources that can help during difficult times, or if it's information that you need, the Ministry of Health website has a lot of information, as you've been told on many occasions. Be resilient. Try to find ways to, stay strong in spite of what you're going through. And during the moments when you feel weak, don't beat up on yourself for it. Understand that it's normal and get help if you need it, or simply find a way forward. Manage the information that you allow yourself to be exposed to. That's very, very important because sometimes misinformation adds to our stress. So again, I want to say stay with trusted, reliable sources of information. As I said before, there's a wealth of information on the ministry's website, and there's also the PAHO WHO websites that provide good information from reliable sources. In closing, I want to remind us that even though we may feel frustrated, we may be tired of the virus, but the virus is not tired of us. So we have to do things that keep us safe and keep our relatives, our loved ones, our friends, keep them safe as well. Thank you.
And thank you, Dr. Othello. Continuing with our series featuring CEOs of the regional health authorities, we are delighted to have Ms. Alicia Bash back with us once again. She will update us on the improvements and the expansion of COVID-19 vaccination rollout in the NWRHA. Ms. Bash.
Hi, good day, Mr. Alexander, Dr. Richards, Dr. Othello, members of the viewing and listening public, members of the media fraternity. Good morning. I'm grateful for the opportunity to provide a further update on NWRHA's vaccination activities. When I was last here, I would have informed the public that we would have had 2 sites in week 1 of the vaccination rollout. Those sites were the Diego Martin Health Center as well as the Barataria Health Center. I further indicated that NWRHA were putting things in place to introduce 2 additional sites. I am pleased to say that as of last week, Wednesday, vaccination activities would have commenced at the Mover Health Center, and we would have seen a great number of persons being vaccinated at that site for the period of a 3-day, which would have been last week, Wednesday to Friday. Approximately 191 persons were vaccinated at Mover. And NWRHA is continuing to expand its vaccination activities with the introduction of the Carenage Health Center as a vaccination site. And that health center will commence its vaccination activities as at tomorrow's date, and we would be vaccinating the NCD patients because the NCD clinic is tomorrow. So at the end of tomorrow, we would have 4 vaccination sites within the NWRHA catchment area, and this provides us with a greater number of sites, which would result in a greater number of persons being able to be vaccinated within the period of time. And we look forward to welcoming our members of the population who would have received appointments already for all 4 sites as we continue our vaccination activities. Additionally, we would have introduced our WhatsApp appointment system as at last week, Tuesday, we would have had 6 WhatsApp numbers that were displayed to the public, and there has been a high level of interest and accessibility of these WhatsApp appointments. For the first 3 days, which would have been last week Tuesday to Thursday, we would have received 480 requests for vaccination appointments. And within Friday, which would have been last week Friday, to this Sunday, which was another 3-day period, we would have received a total of 744 requests for vaccination appointments. So there has been a high level of accessibility with this new technology with respect to members of the population requesting appointments for vaccinations. With the introduction of the WhatsApp appointments, we saw a reduction in our walk-ins as well as our call-ins of persons requesting vaccination appointments as in comparison to the first week. So whereas with respect to the first week of the vaccination rollout, we would have seen over 1,000 persons calling our hotlines with respect to making appointments, in week 2, we would have just received over 250 calls. 80% of those calls would have been persons calling to reconfirm their appointments, and the remaining 20% would have been new persons calling in for appointments. With respect to our walk-ins, within the first week, we would have seen over 2,000 persons visiting the health centers to register their names for vaccine appointments. We would have seen in week 2 just over 300 persons. And that is as a result of the increased accessibility to our 6 WhatsApp appointments because we have a high number of persons accessing it. Over 1,000 persons requesting these appointments via WhatsApp within a 6-day period of the introduction of the appointment system. So the technology is working and persons are receiving their appointments in a timely manner. And we are seeing more and more accessibility to that particular avenue for appointments. With respect to our call center, last week we would have added on additional human resource capacity, which would have facilitated us in calling back persons who would have called in as well as registered via the walk-in process in scheduling appointments. So we would have cleared up at least 90% of those persons, and to date we have scheduled approximately 5,600 appointments for the COVID-19 vaccines. And we want to thank the population for their continued patience with us. We do know there is still some congestion on our PBX line system. And within the next coming days, before the end of this week, we will be introducing a 1-800 number. And with that introduction of that new number, we will be able to now manage the congestion on our PBX lines. So the different issues that persons would have been having as it relates to when they would call our PBX lines, we would more or less alleviate that with our new calling number. Once that is implemented, the members of the public will be informed of this new calling number. And hopefully the user experience with the callings would be a greater one and a better one. And we continue to see more and more persons are willing to accept the COVID-19 vaccine. There's still a high level of interest amongst the NWRHA population, and we want to still encourage persons who fit the criteria as it relates to phase 1 and phase 2 of the ministry's initiative to continue to WhatsApp for your appointments, continue to call in, and we will try our best to ensure that appointments are given in a timely manner. We continue every day to review our activities and to implement any mitigating measures to treat with any shortcomings we may notice within our system. So in closing, I just want to remind persons that as of tomorrow, we would have 4 vaccination sites, which would be the Diego Martin Health Center, the Barataria Health Center, the Mova Health Center, as well as the Carenage Health Center. And with these 4 sites, we would now be able to vaccinate more persons within the NWRHA catchment area. I wish to thank you, and this is the end of my update for this week.
Thank you, Ms. Bash. We now go to our question and answer segment. Our media representatives are kindly asked to begin by stating your name and the name of the media house that you represent before you put forward your questions to our panelists. Because time is always limited, we are permitting no more than 2 questions per media house in the first instance, and if we can, we will allow 1 additional question from media representatives. We begin with CL Communications.
Hi, good morning. From CL Communications, Natalie Singh. This question was put to the panel already, but I was asked the question by a member of the public, and so that's why I'm bringing it back again. If a person has gotten the first dose of the AstraZeneca vaccine and they want the second dose to also be from that same manufacturer, is that possible, and what is the ministry saying when it comes to this? And my second question is, can an 80-year-old with comorbidities be vaccinated? This person was trying to call a health center and they were being told they will be contacted, and they did it on more than 1 occasion. What do you advise this person to do? Thank you.
Thank you very much. Dr. Richards, could you field those questions?
Good morning, Nadaline. Good questions from a clinical perspective as well as an operational perspective. So I will take the first half of the question and then refer the second part of the question to CEO Ms. Bash, given that it's an operational issue. So your question was related to the interoperability and the interaction between different types of AstraZeneca vaccines. So we have actually had vaccines that have come from 2 different manufacturers, one via the COVAX facility and one as a donation from the Indian government. And at present, the current evidence indicates that it is safe and effective to have a first dose from one manufacturer, such as an Indian manufacturer, and then have a second dose from the second manufacturer, which is from South Korea. Now, the current evidence that the Ministry of Health is working with, which really relies on full scientific evidence from the World Health Authority, really indicates this sort of interaction, mixing, or as I say, interoperability between South Korean and Indian manufacturers for the AstraZeneca vaccine. Thank you very much. Now on to CEO Bash with respect to the calling situation for the 80-year-old. Thanks.
Hi, good morning again. From the brief description you would have given, the person appears to fall within the criteria of the first phase of the ministry's vaccination rollout. I'm not sure which area this person presently resides in as it relates to the respective RHAs, but I would suggest the WhatsApp appointment may be the quickest way for this person to receive their vaccination appointment. The WhatsApp appointments do work. The various RHAs do have and have publicly advertised their various WhatsApp numbers. So I would suggest whichever area this person is residing in, they can WhatsApp their request for an appointment within the relevant RHA and within the relevant WhatsApp number. Thank you.
And thank you, Ms. Bash. We now go to AZP News.
Hi, good morning. Prabhi Hari, AZPnews.com. My first question is to Dr. Richards. Dr. Richards, can we get an idea of the number of people who have passed this month? Can you tell me, were they in ICU, their ages, and whether they had NTDs? And my second question, there also seems to be a lot of a lack of social distancing in the outdoor facilities where people go and buy food and vendors and the people who have the businesses that have in-house dining, they are feeling a bit slighted, in which because they would have had proper protocols in their establishments, and now they are seeing outside that there's a lack of that social distancing, for example. I don't know if there's something you want to say about that, and maybe there's a case for them maybe to again to have in-house dining. Okay. Thank you.
Thank you very much, Prior. With respect to the persons who have passed away from COVID-19, the vast majority of persons were receiving ICU care did have comorbidities and did fall into that high-risk group. I can't go into significant details given the ethics and medical confidentiality issues that we practice as clinicians and as per the Ministry of Health regulations. The second part of your question dealt with a policy issue that resulted in an amendment to the public health regulations last week. And that question would be better directed to the Office of the Attorney General, because such decisions fall under the purview of the Honorable the Honorable Prime Minister and other members of government. Thank you very much.
Thank you for asking your question. We now go to 98.1. Okay, we can move to wired 868 if you are ready, and we'll come back to 98.1. Wired 868.
Hi, good morning. Fayola Bostic, wired 868. My first question has to do with the speculation going around with adverse effects after getting vaccinated. So, in the one instance, the gentleman who died after having blood clots, and then, of course, with Minister Khan, who died shortly after receiving his vaccination. Now, no report or statement has come out of any link to the vaccine, but I'm wondering what evidence would be necessary in order to suggest that there is a link between the vaccine and these types of adverse health reactions. And my second question is there any change in recommendations for people with severe heart issues or severe comorbidities with respect to taking the vaccine? Thank you.
Thank you very much for your question, Dr. Richards.
Thanks again, Ms. Bostic. A multi-tiered question here for us. So the first item that I'd like to address involves the two deaths that recently were highlighted and are in the public domain. What I would like to confirm is that the Ministry of Health is not aware of any evidence, and there is no evidence to suggest that these two deaths that were recently reported are related to the AstraZeneca vaccine. I would like to reiterate that as per the WHO recommendations, which look at the safety and effectiveness of the vaccines over a large number of persons, the AstraZeneca vaccine remains a safe and effective form of protection in line with the existing public health measures to prevent COVID-19. The benefits of the AstraZeneca vaccine greatly and significantly outweigh the risk that exists. A second part of your question referred to adverse events for the vaccine. And at this point in time, the Ministry of Health, after administering over 16,000 vaccines, has no recorded adverse events. What we would have noted would have been side effects, which are really very similar in terms of the symptoms for any other vaccine. And these side effects really consist of some tiredness, body pain, maybe soreness at the site of the injection, and they really represent the body mounting an immune response against the COVID-19 virus, and that in that way a person is protected. Regarding the third part of your question, which indicated a change in recommendations for persons with severe comorbidities, at this point in time and as per WHO guidelines and based on robust scientific evidence, the Ministry of Health continues with the vaccination drive and recommends the vaccination of persons over 60 and those with comorbidities. What we do identify and we do recommend is that if a person has a particular comorbidity, they really should seek the advice of their physician. There's also an additional factor to reduce the risk of giving the vaccine to such a person, in that when you go to the health centers, you are screened. We have emergency room physicians on site and we observe you for 30 minutes. Additionally, the Ministry of Health advises that if you believe you are having a side effect or adverse reaction, you are to call 877-WELL and 800-WELL. You can also contact your physician at the health centers via the hotlines that we have advertised. So in closing, I would like to reiterate that the COVID-19 vaccine continues to be a safe and effective form of protection against the COVID-19 vaccine at this time. Thank you.
And thank you very much, Dr. Richards, for that response. We now go to TV6.
Good morning, everyone. Dr. Richards, a review done by the UK drug regulator of the AstraZeneca vaccine shows that there's a risk of 4 in 1 million of developing a clot, and there's a risk of 1 in 1 million of dying. Shouldn't the MOH be concerned, as I assume that you do take logs and records of events post-vaccination, that 2 persons out of those 16,000 have died within 4 days and 8 days after vaccination? That's my first question. Second question, while we wait on the evidence to link deaths or adverse reactions to the vaccine, is there any test or screening that can be done to determine who could be more at risk for developing a clot? Thank you.
Thank you very much, Ravashi. So the first part of your question addressed the findings by the UK drug regulators, which indicated a risk of thromboembolic events or clotting problems of 4 to 1 million. First of all, the Ministry of Health is guided not by any particular country's recommendation, but at this time we are guided by robust evidence from the World Health Organization, which really looks at collating evidence from not one country, but several countries. So in terms of logs and records and so on, yes, we do keep a check in terms of adverse events, and we do keep a log of this, of which we've had none so far, but we are guided by robust scientific evidence from the World Health Organization, which at this time indicates a significant benefit of the AstraZeneca vaccine in preventing COVID-19 in our population. The second question dealt with the recent deaths that were in the public domain, and as I indicated earlier, there is no evidence to suggest a relationship between the COVID-19 vaccine, and that was given within a couple of days, as you indicated, and the deaths of these persons. Of course, we do not go into details about the situation and the deaths of the person and findings around that due to patient confidentiality and ethics that we follow. Another question pertained to what we would wait on in terms of evidence and how do we screen persons with respect to preventing mortality or deaths due to COVID-19. And again, as the Chief Medical Officer has indicated in his previous press conferences, persons are clinically assessed prior to administration of the vaccine. They can seek the medical attention and assessment of their primary care physicians or their specialist physicians, either privately or in the public health system. And upon arrival at the health center, they are screened by nurses and primary care physicians to identify any possible risk factors. So we do have risk management systems in place even subsequent to vaccine administration, and we do contact persons within 24 to 48 hours by telephone to ensure that there are no major issues and to let them know if their side effects are worsening. There's of course a hotline, as I just indicated earlier. So thank you, Ravashi.
Thank you very much, Dr. Richards. We believe that 98.1 is ready now, so we go back to 98.1.
And thank you, Mr. Alexander. Stephen Cummings here, 98.1 FM, and good morning to members of the panel. My two questions quickly for Dr. Richards. Dr. Richards, there is a constant debate over blood clotting. The disclaimer also continues with the WHO, CDC, and other experts saying the benefits of the vaccine far outweigh the risks. But I'm wondering if it would be of benefit to us, or should there be, an initiative to have a closer clinical look at understanding blood clotting and what could be several causative factors, as I believe a vaccine alone may not be the evil as it's being made out to be. Are you able to explain more about blood clotting and what could be several causative factors? The issue of blood clotting is not going anywhere, anywhere soon, and I think that probably there's need for a closer look at understanding what we are talking about when we, when we reference blood clotting. And secondly, there's a view that with emerging variants which are proving to be more transmissible, that there might be need for a third booster to the COVID-19 vaccines. Is that third tranche factored into the national inoculation program should this become a necessity? Thank you.
Thank you, Dr. Richards.
So some very interesting clinical questions, Mr. Cummings. Sorry. Some very interesting clinical questions from you, Mr. Cummings. The first question dealt with the debate over blood clots, and I really like your approach in which you stated that, the vaccine should not be really vilified as the evil part of this. Again, I would like to reiterate that as WHO guidelines, which the Ministry of Health follows stringently, at this point in time, there is a significant benefit to the vaccine considered to risk. Now, there are risks associated with the administration of any drug and any vaccine. And yes, there is a risk of blood clotting, which is very, very small, or sick, and it's not, which is very small. And there are other factors that a person, or we look at as clinicians and as doctors, to identify a person's specific risk to it. We look at the presence of other comorbid conditions or pre-existing medical conditions. We look at the administration of other medications that somebody may be on. We also look at risk factors and inherited diseases that will predispose someone to a clotting event, or what we would refer to clinically as a thromboembolic event. And this sort of assessment is done, as I said, on a two-tiered basis by your primary care physician as well as persons at the local health center where one goes to have the vaccine administered. The third part of your question spoke to emerging variants and the need for, or possible need for, a third dose. At present, and as per the Ministry of Health's policy on vaccine administration, again, based on robust scientific evidence provided by the World Health Authority, the Ministry of Health continues to have a two-vaccine administration for the AstraZeneca vaccine. And this two-part, in terms of the AstraZeneca vaccine, really involves one dose administered initially and then the other administered 12 weeks thereafter. And the 12-week dosing regime has indicated or has demonstrated the highest levels of effectiveness within the population. This evidence, of course, at this time comes from the World Health Authority. So thank you very much, Mr. Cummings, for your question.
And thank you, Dr. Richards, for such a comprehensive response. We now go to Newsday. We are ready for your question.
Good day, Paula Linder here from Newsday. I have two questions for the panel. The first one is a question about data. Of the 900 plus new cases in April, could you or would you be able to give us a breakdown as to the modes of transmission? That is, how many cases are from exposure at beaches, restaurants, cinemas, churches, team sports, public transport, etc. And the second one is with respect to the mental health and vaccine hesitancy being shown in the population. When will the ministry be carrying out a targeted public education campaign to address vaccine hesitancy and educate people about the benefits versus the risks of taking the vaccine? I think this would help to address some of the mental health factors that Dr. Othello spoke about. Thank you.
Thank you very much.
So I'll take the first part of the question, which really looked at the transmission of the COVID-19 virus, and Dr. Othello will of course speak to her area of expertise, which would be mental health and health education. So you indicated that there was a significant rise in the number of cases of COVID-19 over the past month, and in my summary update I would have given the increase in the rolling average of cases per day per week. the population has had community transmission since the end of July 2020, and this did not change. What we've noted really is the expected increase in the number of cases post the Easter vacation, and we are seeing that 2-week sort of increase from the Easter vacation, in which there was congregation of persons in various areas, beaches being one of them. And of course we have a change in public health policy and regulations to really curb this increase in the number of cases. What I would like to stress at this point in time would be the increasing number of cases in the 20 to 49-year-old age group. And we do understand the effects of pandemic fatigue. We do understand the impatience from certain groups in the population regarding the regulations. But I would like to emphasize that even though the 20 to 49 age group may feel that they are at low risk of severe forms of the COVID-19 virus, we have to really remind them that they need to protect and to exercise personal responsibility, especially as it concerns their parents, their grandparents, and other persons who are in the household. So in closing, I want to remind everyone that community transmission has been with us for a while, and that it has been related in terms of the increase in the number of cases, that increased congregation, especially for recreational activities and unnecessary activities, is linked to the increased number of COVID-19 cases. Thank you.
Dr. Othello, could you handle the second part of the
Sure.
question? Thank you so much.
While it is understood that misinformation can make it difficult for some persons to make the decision to take the vaccine, it feeds into why from the beginning we've always been emphasizing the importance of sticking to reliable sources of information. We've been pointing you to the Ministry of Health's website and to the COVID-19 page on that website, as well as to the PAHO and WHO sites for your information, so that you receive accurate information from reliable sources that is less likely to cause persons to be concerned. We've said from the beginning that every clinical decision people make is a risk versus benefit choice, and that the vaccine is not compulsory, but we strongly encourage you to have your vaccine when your group is being vaccinated. The decision is a personal decision, but it's one that we encourage you to do, because we continue to say that the benefits far outweigh the risks.
Thank you very much, Dr. Othello. We now go to the Express.
Kim Mudram from the Express. Good morning, all. I may ask Dr. Abdul Richards to repeat herself a little bit. And this is actually a question I had wanted to ask the CMO, Dr. Roshan Parasram. And it is to come back to the gatherings for Easter and then the domestic travel that we saw, and to ask whether there was a direct suggestion from the Ministry's high-level medical team to government or whoever the relevant authorities would have been, to restrict these gatherings and travel for Easter. And if not, on reflection, should there have been such a suggestion? And again, maybe repeating a little bit, but going back to these really unfortunate deaths seem possibly connected to the vaccine, we don't know. But has this affected uptake since then? Has there been a hesitation by the public since then that might be visible in the numbers? And can we revisit phase 2 again, and maybe just remind the public phase 2 is going ahead? I know Dr. Richards said it's safe. Let's go ahead. So can we just go back there for a second? Thank you.
Thanks again, Kim, for your question. The first question dealt with the proposed link between the Easter festivities and the congregation on that last weekend and the increased number of cases. What I can confirm, and based on the Ministry of Health's data and scientific information, is that there has been an increase, and a significant increase, in the number of cases in the last 14 days, which really represents the time span that we would expect to see a surge from a particular event. We, of course, have linked this event to mass congregation and to persons, intermixing, because commingling, of course, is a very bad word in terms of public health. And here we've seen a lot of commingling that is potentially the cause of these increased cases. Of course, persons mixing and, not adhering to social distancing guidelines really have been confirmed by the WHO and internationally as a risk factor for transmitting the COVID-19 virus. Another issue is that 80% of persons with COVID-19 tend to have mild or asymptomatic symptoms. So we may have persons who were mixing and commingling amongst the population who did not know that they had COVID-19, and of course increasing the risk to persons. Again, any questions related to policy regulations, policy and public health regulations, do fall under the purview of the Honourable Minister the Honourable Prime Minister and the Honourable Ministers in terms of confirming changes to the public health regulation. You asked another question about vaccine acceptance beyond the last weekend, where unfortunately 2 deaths were reported in the media and are in the public domain. As of this morning, we have not seen a decrease in the vaccine acceptance rates, and the CEO Bash can confirm the number of appointments or requests for appointments that are currently in place by persons. The third part of your question looked at the different phases for administration of the vaccine, and I'd like to confirm that as of this morning, we are continuing with our planned vaccine rollout exercise, which is currently into phase 1, going into phase 2. Phase 2, of course, represents essential workers such as teachers, police officers and immigration officers, and others who are in direct contact with persons who are of unknown risk. Phase 3, of course, looks at the administration of the vaccine to other members of the population who were not categorized in phase 1 and phase 2. So I hope that these responses have been clear and that they are accurate in terms I can confirm to your question. Thank you.
And thank you very much, Dr. Richards. We now go to Guardian Media. We are ready for your
and to Dr. Richards this morning, Annalisa Paul, Guardian Media, sorry. Dr. Richards, there was a call this morning by one of the business chambers for consideration to be given to the reopening of the borders, especially with the administration of the vaccine, especially to business persons here who need to travel for professional purposes. Is that something that perhaps now that we're seeing persons coming forward to be vaccinated that may be considered? And secondly, I know that opposition and cabinet ministers were to be among those in the second phase coming in for vaccines now. Can you tell us, in terms of the numbers, how many persons in terms of the cabinet as well as those opposition members who may have presented to be vaccinated at this time, please? Thank you.
Thanks very much, Ms. Paul. So the first question in terms of amendments to the border policies, yet again, is based on robust scientific evidence provided by the Ministry of Health, and really that decision lies with the Honourable Prime Minister who sets policies. So that question about vaccinations and the availability of travel would be best directed in that direction. The second question was pertaining to the number of parliamentarians and members of parliament, ministers, cabinet members who received their vaccines. At this point in time, the Ministry of Health is collating that exact figure, but you can work through our corporate communications department for an exact figure that is accurate and representative. Thank you very much.
Thank you, Dr. Richards. We have a follow-up question from AZP News.
Hi, good morning again. Before I ask my question to Ms. Bash, I just wanted Dr. Richards just to go over the figures in terms of the increase in the patients at the ICU and the HDU. I actually feet broke up there, when I said that. Thanks. So my question now to Ms. Bash. Ms. Bash, in terms of the appointment system and how the vaccines have been rolled out, can you safely state now that everyone would receive their first jab and the second one in time before the vaccines expire? Thank you.
So I'll take the first part of the question, which looked at the occupancy rates in ICU and HDU. Between weeks 1 and 11, the ICU occupancy rate was between 0 and 5% across the hospitals in the parallel healthcare system. The HDU occupancy levels for this period were between 0 and 4%. What we've noted between weeks 11 and the end of week 15 has been a steady increase in the occupancy, which takes us to actually 20% for ICU beds as of today, and the HDU beds has wavered somewhere between 5% and 15% depending on the date. But the overall trend has been one in which there has been an increase in the number of persons hospitalized that require ICU and HDU care. I'll now hand over to Ms. Bash for the second part of the question.
Again, thank you for your question. As I indicated before, with respect to our increase in our vaccination sites by adding on 2 additional vaccination sites, it provides us with the opportunity to now vaccinate more persons within our catchment area, and we are increasing our vaccination activities to ensure that the persons who have expressed an interest and have been given appointments do receive their vaccines before the expiration of the first tranche of the vaccine doses. Thank you.
Thank you very much. And we now go to wide 8. Thank you very much. And we now go to wide 868.
Hi, good morning. Phil again. All right, so my question kind of goes back to the one I asked to just get a little more clarification. I know some countries, for example, are requesting or guiding health officials to take platelet tests, for example, to determine whether or not blood clots are linked to the vaccine. So I'm wondering what specific evidence are we looking for to determine whether or not there's a link between vaccination and any adverse effect?
Right, thank you, Ms. Bostic. I'll take this question. Thank you, Ms. Bostic. I'll take this question. The Trinidad and Tobago and the Ministry of Health particularly is guided by WHO recommendations regarding the AstraZeneca vaccine. As of this time, there has been no guideline or recommendation from the WHO to do routine platelet testing. However, if a patient is assessed by a clinician, which I've been reiterating, because of potential risk factors, then there may be a need by that physician to do routine blood investigations, of which platelet counts may be one of them. We work on specific evidence from the World Health Organization based on robust scientific studies that are ongoing, not particularly one country or the other. At this time, the World Health Organization highly recommends the administration of the AstraZeneca vaccine given its the benefits outweighing any risk associated with it. So thank you very much, and I hope this clarifies your question, Ms. Bostic.
We just have room for one quick question, and we'll take that question from TV6.
Dr. Richards, there's a cohort of TNT students studying abroad and they're on break from May to August while the universities are closed and the fees for rent, living expenses, etc. Are you aware of any arrangements in place to allow them to come back home during this period? Because someone applied since January, they sent me their registration status and they got no response just yet. Thank you.
Thanks, Avashi, for this question. I would like to emphasize that approval for exemptions to enter into Trinidad and Tobago fall under the purview of the Ministry of National Security. Notwithstanding this, the Ministries of Health and the Ministry of National Security do collaborate to ensure the safe return of our returning nationals, and we have planned repatriation flights so far where we've had basically the intake of possibly between 110 and 140 persons. So I'm sure that these students, based on their requests, will be accommodated during that time period, but questions regarding the speed of an application should be directed towards the Ministry of National Security. Thank you.
And thank you, Dr. Richards. Ladies and gentlemen, we have come to the end of the question and answer segment. The Ministry of Health thanks you for joining us for today's COVID-19 update. We trust that the information shared this morning was informative and to your benefit. Remember that even though we continue to have high uptake of the COVID-19 vaccine, we need you, the public, to continue to follow the health guidelines. Remember the 3 W's. Wash your hands, watch your distance from others, wear your mask. Follow these 3 W's, and if you are a frontline healthcare worker, over 60 years of age, or have any non-communicable disease, go get vaccinated. Thank you and enjoy the rest of your day.